Alrighty. Class stand. Put your seats in the upright position. Yeah, you might need seat belts. Yeah, it's complete. I'm in the seat. It's called Ultimate Health on Joy 99.7 FM. This and every Sunday, 2:05. We are indeed alive and airborne. Wow, it's been a tough week. A weekend of funerals. Last night ahead of the passing of Dr. Michael Ejekum of Kama. My goodness. Such an inspiration. But hey, we've got life. We'll take this from Desiree.
Joy 99.7 FM. Joy 99.7 FM.
Afraid of the dark, especially when I'm in a park and there's no one else around. Ooh, I get the shivers. I don't wanna see a ghost. It's a sight that I fear most. I'd rather have a piece of toast. Watch the evening.
Joy 99.7 FM.
Oh, life, oh, life. Do, 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 life, oh, life. Oh,
Joy 99.7 FM.
oh, life. Do, do, do. I'm a superstitious girl. I'm the worst in the world. Never walk under ladders. I keep a rabbit's tail. I'll take you up on a dare. Anytime, anywhere. Name the place, I'll be there. Bungee jumping, I don't care. Life, oh life, oh life, oh life. Do, 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 do. Life, oh life, oh life, oh life. Do, do, do.
Joy 99.7 FM.
Do, 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 do.
Joy 99.7 FM.
So after all said and done, I know I'm not the only one. Life indeed can be fun if you really want to. Sometimes living out your dreams ain't as easy as it seems. You wanna fly around the world in a beautiful balloon. Life, oh life, oh life.
Yeah, we give praise always.
Do, 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 do. Life, oh life,
If you can hear me,
oh life.
most definitely we're on God's wake-up list today.
Do, 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 do. Life, oh life, oh life, oh life. Do, 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 do. Life, oh life, oh life, oh life. Do, 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 do.
Joy 99.7 FM.
So if it impacts on your health and your well-being, we'll definitely talk about it on Ultimate Health Joy 99.7 FM. So today we take a dab at hepatitis, inflammation of the liver. What else do we know? I'm not going to try it. I've got guests in the studio who are here for just that. I've got Dr. Amakudria. He's a consultant gastroenterologist with the University of Ghana Medical Center. Dr. Yvonne Ayekinate. She's a physician specialist with the Cape Coast Teaching Hospital. We're going to be learning what hepatitis is, what the different types are, who gets it, how do you get it, that is route or root of infection, whether it becomes chronic, acute, can you do something about it? So stick and stay, don't go away. We're live on Facebook and YouTube. Ultimate Health on Joy 99.7 FM. Docs, you're most welcome.
Thank you.
Thank you.
Lady and gentlemen, Docs. You're welcome to Ultimate Health. And like I say to my listeners every Sunday, if it impacts on your life, your well-being, we'll definitely talk about it. We hear a lot, or we believe we hear a lot about hepatitis, but it's never too much when it comes to education information that will transform and empower us. So let me start with you, Doc Dua. All right, mine is Dua Ga.
Yes.
Yours is where's yours from?
Dua Ashanti.
Ashanti.
Yes.
So who stole whose? I'm always told that mine must have been stolen. It cannot be mine. But hey, I'm Nortey by nature, so I dropped the Dua or Dua so that nobody gives me, trouble. But what is hepatitis, Doc?
So in general, when we talk hepatitis, it means that it's inflammation of the liver.
Okay.
And for me, in a common way, I explain it as the liver cells are breaking down.
Okay.
Okay. So whenever we say hepatitis, it means that liver cells are breaking down.
Okay.
Yes.
Right. I guess it will help our listeners, just by way of basics. What's the liver? What does it do? Why should we be worried if something is happening to it?
So liver is one of the major internal organs.
Okay.
And we say that is the biggest internal organ that we have as human beings.
Okay.
And being the biggest internal organ, it performs a lot of various functions that help the body also to function well.
Okay.
So I always say that it's the major detoxification organ that we have in the body. Because as human beings, when we eat, all the food that we absorb at the end of the day will pass through the liver before it gets into the system again for the body to use. So any microbes, any toxins that are found in the liver, that are found in the food, the liver take it away.
All right.
Okay. It also produces a lot of major proteins that the body needs. For example, albumin. Albumin is a protein that helps to maintain fluid in the blood vessels.
Okay.
So when the liver is not producing adequate albumin, you see that some of the fluid get out of the blood vessels, and the legs will get swollen, the tummy will get swollen.
Okay.
And that one, as we go along, will be like one of the major clinical manifestations of chronic liver disease.
Okay.
Okay. It's also produce clotting factors. These clotting factors help the blood to clot, especially when you get a cut.
All right.
It seals off, and it's the liver that produces most of these clotting factors.
Okay.
So if the liver is not producing these clotting factors, it means that when you get a cut, the probability of stopping is very high.
Okay.
Okay. And it also helps stores most of the food that when we eat, we don't use during the day. So it store carbohydrate in the form of glycogen. It store minerals, it store vitamins.
Right.
So for example, when you lack vitamin B12, okay, the liver will have enough stores, and it will take several years for you to experience that you lack vitamin B12.
Right.
So these are some of the
very
functions
busy,
that
serious
the liver
organ
performs. Sure.
Right. Okay.
Yes.
Dr. Nortey, so we're essentially talking about an infection of the liver when we say hepatitis.
So when we say hepatitis, we actually mean an inflammation of the liver.
Okay.
Of which infections
Can you just move the mic closer to you?
Of which infections can be a cause of inflammation.
Right.
But there are other causes of hepatitis as well that are not infections.
Okay.
So you can have things like alcohol causing hepatitis.
Okay.
You can have things like fatty liver.
Okay.
So what we call the non-alcoholic fatty liver disease can also cause hepatitis.
Right.
Then we can have things like autoimmune causes where the body mistakes its own organs as foreign and starts attacking itself or attacking its own liver.
Right.
So that's autoimmune. Then medication or drugs of particular types can also cause hepatitis.
Okay.
And herbal medication is also an example of drugs that can cause injury to the liver and cause hepatitis.
Okay.
But in our setting, yes, infections like the viral hepatitis from hepatitis A to B to C to D to E
Joy
can all cause inflammation of the liver.
Okay, so hepatitis specifically, we are talking about an inflamed liver, inflammation of the liver.
Yes.
Okay, and if we're talking about hepatitis and we're talking about inflammation of the liver, then we're talking about a particular or a specific cause, right? Which should be related to what is it? A virus, hepatitis virus.
Yes.
Right. Okay. So you mentioned already different types. You've given them names by way of letters of the alphabet. Okay. So how does one get hepatitis? Since it's caused by a virus and there are different types, how do you get hepatitis? Or are we going to have to deal specifically with the types before we get the cause? Who gets hepatitis, Doc?
So any human being that gets exposed to these viruses, okay, can get these viral hepatitis that we are talking about. So he mentioned A to E. Okay, so for A and E, we get it through food or water that is contaminated with these viruses.
Okay.
So we say more like it's fecal-oral.
Right.
So these viruses are found in our feces when they get contaminated with food or water, and then we take in, then we get these viruses. Okay. And then the B, C, and D, we get exposed to these viruses when someone is infected with these viruses, and that person's blood, okay, or discharge from the wound, or rashes, okay, get inside uninfected person.
Okay, Doc, let me slow you down there. A and E,
Yes.
right?
Yes.
Contaminated, infected food or water.
Yes.
Then you used fecal oral.
Yes.
It means we're taking it in through the mouth, right? For the layperson.
Yes.
What we eat, what we drink, and so on and so forth.
Sure.
Okay.
Yeah.
That is hepatitis A
And
E. Right.
Yes.
Let's just dispose of those ones, all right? So A and E, the root of infection is different.
Yes.
All right.
Yeah.
Okay. So either we are not handling our products well, our sanitation and all that, and then food, water sources get contaminated.
Sure.
Okay.
Yeah.
Before it got into the food or water, you mentioned feces,
Yes.
fecal matter.
Yeah.
Okay. So the person who excreted or eliminated that feces had hepatitis before?
Yes.
Okay. You see where I'm going with this?
Yeah.
Right? So where did that person get the hepatitis before it became transmittable through the oral fecal channel?
So that person too will get it through the same route as we are describing.
Okay.
Yes.
So is it, should I say, resident in the feces? Is it a product in there?
So it's not everybody. Let's say it's not everybody that walk around with hepatitis A or E. Okay, but it's those who have gotten infected with these viruses.
All right.
They have the viruses in their feces.
Okay.
So when they excrete it, then the virus also come out.
Okay.
Yes.
All right. 16 minutes past the hour of 2 on Joy 99.7 FM. The program is Ultimate Health, your ultimate guide to healthy living with. Got a gastroenterologist in the studio, Dr. Mwakundria. He's with the University of Ghana Medical Center. And Dr. Yvonne Ayeki Nortey is with the Cape Coast Teaching Hospital. She's a physician specialist. All right. Any questions on hepatitis? Shoot. Facebook, YouTube, and WhatsApp is 055 11 11 997. Shortly, I will activate the phone lines so that you can infect them yourselves. All right, and ask the questions. But I'm being a bit, it's like when a child asks you, "Mommy, where do babies come from?" Right? I want our listeners to get this. So that is A and E.
Yes.
Okay. Still with tidying up A and E because I know the big business is B and C. So once you have that through the oral fecal channel, will you show signs, symptoms? What's just the progression of A and E?
So mostly about 75 to 80% will not experience any symptoms.
Okay.
Okay, so they will get it, and it will be in the system.
Okay.
But one thing about A and E is that it doesn't cause chronic infection. So
Okay.
the body is able to eliminate it within 3 to 6 months.
Okay. Your body can deal with A and E.
Yes. clear it within 3 to 6 months.
Okay.
So it does not become chronic.
Okay.
Okay. And those who normally develop symptoms are mainly mild symptoms like fatigue, fever, chills,
Okay.
headache, abdominal pain.
All right.
And a few of them will develop jaundice,
Okay.
yellowing of the eyes.
Okay.
So these are some of the symptoms that those who get infected with A and E
Okay.
develop.
All right.
And because they resolve by themselves, we don't give any particular medication. We
Right.
just manage them symptomatically.
Okay.
Even if they develop symptoms.
Okay.
But as I said, majority will have it, and the body
It should
will-
run
will
its
deal with
course.
it. Yes.
Okay.
Yes.
So the person is ill, but all things being equal, the body and its defense mechanism should be able to deal with hepatitis A and E.
Sure.
All
Yes.
right.
Yes.
So sometimes people go in, they are told these things, and they're told go and rest, and they don't get it. Right? Dr. Nortey, is this a safe thing to say that probably you've been infected with A or E, and therefore whoever is managing you has looked at it, isolated the type, and then is following what should be followed?
Yes, but there's a particular group of people, for example, pregnant women,
Okay.
who, when they get hepatitis E,
Right.
or if we suspect them to have hepatitis E,
Mm.
we will monitor them a little bit closely.
Okay.
Because we know that hepatitis E can have some serious consequences in pregnant women.
Okay.
But for the general healthy adult, when they get A and E, as Dr. Dia said, it's self-limiting,
Okay.
and we will not be too concerned about any serious consequences from
Okay,
those infections.
right. 90 minutes past the hour of 2. If you just joined us, we're talking about hepatitis. We're breaking it down. Our key, areas of concern tend to be B and C. We'll get there, right? But I want to get a certain foundation and a baseline so that we all understand where it's coming from, who gets it, and so on. And then what, importantly, is the route or mode of transmission. How do you get it? Okay, I've done programs where all sorts of things were suggested because people distorted the information, right? You sit next to somebody in a trotro, and then this one, and now. Listen carefully, okay? Right? Listen carefully. Ultimate Health is also time limited. It doesn't get chronic. So by 3 o'clock, we should be done, but we want to make sure we cover the issues. Okay, so that's A and E.
Yes.
Right.
Yeah.
So would you say, by way of is it epidemiology or prevalence and all that, it's not a big problem, those two, unless in the special cases that Dr. Nortey mentioned? A and E shouldn't be worried about?
Sure. So if you look at A, for instance,
Right.
I think the prevalence of A in this country is higher than all the viruses that we have talked about.
Okay.
But because it doesn't cause really a big issue,
All right.
So we normally don't pay much attention to
Okay.
it. As I said, only few people normally get symptoms, and when they come to hospital, because it's self-limiting, it doesn't cause
Okay.
much issue.
But definitely do
Yes.
go to hospital. Do
Yes.
present.
Yes, some
Yeah?
will come to hospital.
Yeah.
Yes.
So if you don't and you have this jaundice or yellowish eyes, and with A and E, will you still get the dark urine and stuff like that?
Yes, so once they develop the jaundice,
Okay.
the dark urine will come.
Okay.
And mostly that's the one that will let them come to hospital.
Okay.
And through investigations, we will get to know that it's hepatitis A.
Right.
Once it's A, we just reassure them, and within a few weeks, they just
Okay.
recover.
Important thing
fully.
being, still
Yeah.
do go to hospital because you don't know the type.
Sure.
Right. So you must present at hospital if you have these things. Okay. So that's A and
And
E.
E.
All right. So we're doing the alphabet in a funny way. We've gone from A to E. Now we're coming back. Right. B is the big one we talk about quite often. Which of you take B? What's hepatitis B?
Okay, so hepatitis B is also one of the major causes of viral hepatitis. In fact, it's the leading cause of viral hepatitis in Ghana.
Okay.
And about 1 in 10 Ghanaians is infected or would have been exposed to hepatitis B.
These ones, I
and
like you to, as they say, project it. 1 in 10 Ghanaians
Yes, so
has
roughly,
either been
9 to
infected or
10%.
exposed. Right.
and
Okay.
would test positive for hepatitis B.
Okay.
But what's interesting in that across the country,
Mm-hmm.
the people who are affected is slightly different.
All right.
So in the north of Ghana, in the 5 northern regions, that number is almost 1 in 5 who would have
So
hepatitis
there's a higher
B.
prevalence.
Yes,
Okay.
exactly. In the 5 northern regions.
Mm.
And then in the southern part of the country, it is about that 1 in 10.
Okay.
Yes.
Right.
And
Are there any peculiar or regionally peculiar risk factors that account for this higher, should I say, prevalence up there?
so one of the major modes of transmission, which may be related to the peculiar reasons, is mother-to-child transmission
Okay.
in our part of the world. So a pregnant woman passing the virus to the baby, either during delivery or soon after
Okay.
birth.
Right.
And when we look at Ghana in terms of access to healthcare, access to resources, we do know that in the northern parts of the country, things like distance to a healthcare facility,
Okay.
or the number of women who are receiving antenatal care, or the number of women who are tested for hepatitis B,
Right.
or the number of newborns who are vaccinated at birth to protect is a little bit lower
Okay.
compared to other parts of the country.
Right.
So this might be one reason.
Okay.
But we do need to do further studies to understand better why there's such regional disparity.
Okay. So still on hepatitis B, if you've just joined us, you're welcome. We're continuing. I'll do a wrap up in a bit. So still on B, what are the particular characteristics and features and signs and symptoms of hepatitis B?
Okay. So hepatitis B can also do an acute infection just as A and E can do.
Okay.
But
Acute
it's
being short-lived.
short-lived, exactly.
When we say acute in medical terms, we're talking about less than 6 months?
Precisely.
Right.
Yes.
Anything beyond that is chronic.
Yes,
Okay.
exactly. For for chronic hepatitis B,
Okay.
more than 6 months.
All right. So we're
Yes.
talking about a short-lived infection. It will do its stuff, do its damage, and then, that's the acute phase.
Yes.
Okay.
But when it persists for more than 6 months, it can become chronic.
Mm.
So when someone gets hepatitis B, most people actually will not have symptoms.
Okay.
But some people can have symptoms, and those symptoms can be what Dr. Dia already mentioned, things like yellowing of the eyes, that's the
Okay.
jaundice, the fatigue, generally feeling unwell. Okay. For those who have symptoms, that's how they might present to hospital.
Okay.
But for the majority who don't have any symptoms, they might not even know that they have hepatitis
Okay.
B. Okay. And many a time, by the time somebody comes to the hospital when they have symptoms, it may be because that hepatitis B has now progressed into something else.
So it's probably been there for a while.
Exactly.
Okay.
And then they'll come at a later stage
Right.
of disease.
Okay.
So depending on the age that somebody is exposed, that can also determine whether the person will have an acute infection and the hepatitis B will be cleared,
Okay.
or they will have a chronic infection that will last long term. When a baby is exposed to hepatitis B, they have a 95% chance that they are going to get chronic infection,
Okay.
compared to when an adult gets exposed to hepatitis B.
Typically, these babies are getting it through or via vertical transmission.
Potentially
Mother to child.
Yes.
Okay.
Or what we call early horizontal transmission.
Okay.
So somebody in the immediate household who potentially has passed hepatitis B on to the baby or
Okay.
to the newborn. Yes.
Right.
When an adult, on the other hand, gets exposed to hepatitis B, they have a much higher chance of clearing it, and only about 5% of adults will actually go on to develop chronic hepatitis B.
Okay. So our systems should be able to take care of hepatitis B as well, right? Unless something is not okay already.
Exactly.
Right. So that would also restrict it to the acute phase. Your body will sort it out. Okay. Coming back to you, Dr. Dia, I mean, when I hear the figures, the statistics, it tells us, well, this is around us. Okay. This one was oral fecal. How are we getting the B? Apart from the, vertical, what are the other, modes of transmission?
Okay. So the main mode, it's hepatitis B is bloodborne.
Okay.
So the main mode is through blood. When you get exposed to somebody's or infected person's blood.
Okay.
Okay. So that's what he said, from mother to child or early horizontal.
Okay.
Okay. But it's also found in fluid from wound. If you have a wound.
All right.
Okay. The fluid that comes out also contain the viral hepatitis B.
Okay.
If you have rashes, the fluid that comes out of the rashes also contains hepatitis B.
Are these rashes part of the disease picture? Will you get rashes if you have hepatitis, or is it that if you have rashes already from another cause?
So when you have rashes already from another cause,
right?
Okay, hepatitis B, yes, can cause rashes,
right?
But that one mainly doesn't contain fluid.
Okay.
Okay, but when you have the hepatitis B already,
and then you have
rashes that contains fluid.
Okay.
The fluid in it, can be contaminated with the virus.
Okay, right, understood.
Can be
right.
passed. Okay.
Okay.
Yes. As you said, some people think that any form of body fluid is contaminated with hepatitis B.
Sweat.
Yes. So that's what people talk
Saliva.
about. Yes. Okay. But all these fluid have been found not to be a source of transmission.
Say it again, no.
Yes. So sweat,
because you
saliva.
keep saying, hang on, because you keep on saying yes. You don't know when somebody tunes in or when their dial moves a bit, then they come back and they hear yes. So you cannot, or it is unlikely. Is it cannot?
You cannot.
Okay. It doesn't need Supreme Court interpretation.
Sure.
You cannot get hepatitis B through sweat, saliva, tears.
Even breast milk.
Okay.
Yes.
Right.
You cannot get it also through blood.
All right.
So body fluid, apart from what I have talked about.
What about by sexual intercourse?
So yes, sexual intercourse can happen. Okay. So in semen or vaginal fluid, the virus can contaminate this fluid.
So you can get it.
You can get it.
It can be sexually transmitted.
Yes, it can be sexually transmitted.
Okay.
But even that one is rare. It normally doesn't happen, but it can happen.
Right.
Yes.
Okay, 30 minutes past the hour of 2. I'm being very, very, I've got them in the witness doc or whatever they call it. I will cross-examine them. But the phone lines I will activate 030-221-6541. 030-221-6541. Now, we're going through the full range, the full Monty, the full 360 when it comes to hepatitis awareness, screening, testing, treatment. Okay, we'll go through the full range. My guests have told me there's a program which offers free treatment. We haven't gotten to that word yet. Treatment for C, which they will be telling us about. Okay, but we want to understand the full range and a range of the things you'll be hearing from the health professionals or the facilities where you go, so that you understand. And if you don't understand, you can ask them questions. Phone line 030-221-6541. Program is Ultimate Health on Joy 99.7 FM. Our topic, hepatitis awareness, screening, maybe let me add testing, treatment and management. My guest in the studio, Dr. Amoakundua, is a consultant gastroenterologist with the University of Ghana Medical Center, and Dr. Yvonne Ayaki Nate is a physician specialist with the Cape Coast Teaching Hospital. You've got them to yourselves. You can ask questions through WhatsApp or directly via the phone. Okay, coming back to this. So you mentioned signs, symptoms, things we might see. Is there a conclusive diagnostic procedure or test? Okay, we get these a lot. People go for church screenings and other things, and then they say, hey, they said I'm positive for this and that and that. Is there a test or is there a screening protocol for this?
Yes, so the usual screening test that we will do is what we call the hepatitis B surface antigen test.
Okay.
So that will let us know whether you have been exposed to hepatitis B.
Okay.
And if it is positive,
Mhm.
it may mean that you have chronic infection. Okay.
Slow down. The hepatitis B surface antigen test
Yes,
will
that's
tell
the
us
usual screening
the
test.
usual, the normal one. So when you hear all these plenty hepatitis, it's typically the surface
antigen test.
right. If you are declared or identified to be positive for hep B by this test, you went further to say it not only confirms that you have the hep B, but it also tells us how long it's been there.
So it may tell us.
Okay, that's why I asked you to
Yes.
slow down.
Yes, it may tell us.
Okay.
So there are different situations. Let's say you did a screening test today and you only did the surface antigen test.
Okay.
And then 6 months later, you repeat the test, the surface antigen test,
Okay.
and it is still positive.
Okay.
Then by our definition of chronic hepatitis B, which we've said is more than 6 months, then it's likely that you have chronic hepatitis B infection.
All right, which means your body was not able to clear it.
Yes.
Okay.
But we usually don't even need to wait for that long.
Okay.
If you are surface antigen positive,
Right.
then we can do what we call the profile, the hepatitis B profile. And this will let us know about other markers in the blood
Okay.
that will let us know if you have chronic infection
Okay.
or not.
All right. So essentially, all these tests you're talking about are blood tests.
Yes.
We're taking a sample of your blood and we're checking it for this surface antigen, and then we may profile it or investigate further.
Exactly.
Okie dokie.
Exactly.
Right. Now, in our part of the world, in our country, this test we're talking about, is it covered? Is it free? What is it? How are we doing this?
So I think the surface antigen is covered by National Health Insurance.
Okay.
Okay, so
Right.
that one is not an expensive test.
Okay.
Even if it is not covered, I think it's around 15 Ghana, 20 Ghana cedis.
All right.
You should be able to do this screening. And as we said, people go around even doing it for free.
Right.
When you go to any pharmacy, they should be able to do this test
Are
for
we?
you.
Should we be
Yes.
okay, Doc? All right. Ghanaians love free things, but I mean, somebody sets up something and then they add. Some church has a committee. They add it or they bring people. Who should be testing us? Before we even get to see another, who should be doing this test?
So ideally, this test should be done by, a qualified health professional
Okay.
who knows what this viral hepatitis is about.
Okay.
And can give you some form of education
All right.
when you test positive.
Okay.
Okay. But sometimes, people go out, they do the screening, they don't have much knowledge about hepatitis B.
Right.
And then they tell those who test positive give them all sorts of information.
Okay, that's the reason I asked this
and at
question.
the end of the day,
Yeah.
it tends to confuse them.
Okay.
So even if you go out and you do this screening and you don't have much information, once they test positive, refer them to appropriate specialist or a facility
Okay.
that can do further evaluation
Right.
for them.
So
And
that you
then-
know what exactly
Yes,
has
yes.
been identified,
Sure.
and then what the next steps are.
Sure.
All right, that's very important. 36 minutes past the hour 2. This is from Hayford in Bator. Good afternoon, Nortey. How are you and the doctors? Please, is it good to go for tablets that can help you get sleep if you are not? Oh, this is from last week. Sorry. Oh, I'm reading last week's message. What have I done now? Oops. Just a sec. Okay, so today, good afternoon, Nortey and doctors. Please, how are you? We are fine. Please, I'd like to know how the names come about. For example, A, B, C, E, and all that. Where did we get these names from? Is it just a system of identification?
Yes, system of identification, and it's mainly the year of discovery of these viruses.
Okay, so we discovered A first?
Yes,
Okay.
and then followed by B and C, and then
Okay.
the rest.
All right. Thanks, Hayford. So we want professionals to be doing these tests, providing some information, some counseling. Some may be pre, and of course, after you've been tested, you need to be counseled as well as to what the next steps are, and so on and so
Sure.
forth. Okay.
Sure. Or even if they cannot do the proper counseling, they have to link them to care.
Okay.
Okay, so that as you said, the other evaluation and processes will follow.
Okay.
From there.
My phone line is active. This is your blood, though, not my blood. Everybody's blood. So please do call 030-221-6541. I've got the professionals in the studio. Dr. Yvonne Ayeki Nortey is with the Cape Coast Teaching Hospital. She's a physician specialist. And then I have a consultant gastroenterologist from the University of Ghana Medical Center. I slow down because I automatically will say medical school, right? But he's in the person of Dr. Amoakudia. They are teaching us about hepatitis, and then we want to know what happens, what are the possible outcomes when you are tested, what will you be told immediately, what requires further follow-up, further medical and laboratory follow-up. Many people forget that. Sometimes they are told and they still default. Okay, sure. So we want to understand all those. What is chronic? What is acute? What will or should your body be able to deal with by itself if you are healthy, hale and hearty, right? And what can present as a more chronic, enduring condition that raises many concerns. I have not mentioned liver cancer and other, should I say, downstream or advanced complications, right? But they are in there somewhere. We're not there yet, all right? So 0302-221-6541. Let me see. It's in the post box. This one says, oops. Good afternoon, Nortey. Please, I joined late and heard something about rashes. You see your life. Can the doctor kindly summarize the signs and symptoms of hepatitis? Okay. Right. We brought in rashes when mode of transmission came in. Is it possible to do a quickie, or should we go forward and then come back and wrap that again? Any of you?
Okay. So the majority of people may not have symptoms. Okay. They'll walk around without any symptoms, without knowledge of the fact that they have hepatitis B. So just that as a side, that's why it's very important to actually know your status. But for those who do get symptoms, they could have yellowing of their eyes, what we call jaundice.
Right.
They could have fatigue, extreme tiredness. They could have a low-grade fever. Okay. That's if it is an acute infection. That's what we've said is the short term. Right. But sometimes people who walk around for a while not knowing they have hepatitis B or C, when it progresses, as you hinted at earlier, when the liver is not doing too well or they have liver cancer, that can also present with symptoms, and that might be the first time that the person is being told that they have hepatitis B or C. And those symptoms can also be things like yellowing of the eyes, the jaundice. Their tummy can get bigger because there's fluid in there. Their feet can become bigger or swollen. They can be a little bit confused. Okay, they may
swollen
lose weight.
Tummies are quite popular, or should I say, common?
Yeah.
Right, but we're not saying everybody with polytank or pot belly in the mid regions has hepatitis. Okay, but then you could have that swelling of the abdominal area. Okay, right. All these things we're saying, are they premised on the assumption that your liver is fine? So let's say I have something that's already damaged my liver, or other things are damaging my liver, right? And I get hepatitis, then probably I'll get a worse ride. Or?
Yes, so if you already have things that can cause liver damage or liver disease, and you add on a second thing that can cause liver disease. For example, you have hepatitis B infection, and then now you also abuse alcohol, or you abuse herbal medication. That can speed up the damage to your liver. And that will advance your liver disease.
So all of you who have been called to the bar, you know what I mean. Please, serious alcohol use is a risk factor in there already, okay? And we're talking about serious infectious conditions. We're talking about people who are positive in what will happen, and the body will do stuff and sort it out. And it sounds like being positive is not a big deal. Can you clear my mind and the mind of my listeners? If I am tested positive, all right, we've done and dusted A and E, but with B, if I've been identified, tested positive using the surface antigen test, right? Are there things that I should do and should avoid, and so on and so forth? And for a lot of us, this brings the issue of disclosure. Should I tell my partner, my family, my friends? It's sounding, forgive me, like it's not yet a big deal.
So I would say it's a big deal. Okay, to an extent. Just in terms of, it's important to know your status. It's important to be linked to care.
Okay.
Just so that you know whether, for example, you need to be put on treatment or not.
Right.
But whether or not you are going to be put on treatment, you should be monitored.
Okay.
Anybody who is hepatitis B surface antigen positive,
right,
we will do further testing to let you know whether you need to be put on medication specific to the hepatitis B virus or not.
Okay.
If you need medication, you have to be followed up. If you don't need medication, you still have to be followed up.
Okay.
Because we want to make sure that you are not going to get any complications like liver cancer, for example.
Okay.
So it's not a big deal in terms of the fact that you can go about and live your life. Just make sure that you are avoiding things that can damage the liver, like excessive alcohol consumption, using medicines like herbal medicines that could affect the liver. Okay. That's important.
Okay.
But it's a big deal in terms of the fact that because liver cancer is such a big killer in this country, particularly for men, we must make sure that we are monitoring all patients who have hepatitis B, that they are being linked to care and we are following them.
All right. I like the link to care. We've mentioned some statistics, 1 in 10, depending on where you are in this country, it could be 1 in 5, a higher prevalence. But what we're saying here, what the doctors are emphasizing is that don't just be happy being one of the 10. Right? And I listened to Nortey on Ultimate Health. It's not really a big deal. My body will sort it out and all that. You should be followed up. Right. So before we get to see, very quickly, so your details, your name and all these things, contact numbers. In these routine screenings we hear of, this should be part and parcel of the process. Or how do we follow people up? Because we have a lot of stuff going on in the name of testing or screening. I'm just trying to get best practice here, because people are a bit reticent about giving out their numbers and things, especially when it's to do with screening and stuff. Should it be part and parcel of a process? If my blood has been taken, I need to be identifiable and so on and so forth. How should it be done to make sure that I remain linked to care? Doc?
Okay, so once your blood has been taken, a test has been done, the results has come, whether it's positive or negative. So if it is positive, you will be told.
Okay.
And then you will be linked or you will be referred to, a professional who will be able to manage you and monitor you, based on the results that you have gotten.
Please, teacher, question.
Yes.
Refer to a professional. Am I talking doctor? Am I talking lab technician? Who is doing this business? Okay, handling the blood, the testing and all that, I know there's a cadre of professionals for that.
Yeah.
But this discussion and interpretation of the results and then the follow-up steps, that baton change, I didn't quite hear it.
So you will be referred to a hospital.
Okay.
Where you will see a doctor.
Okay.
Okay. And if the doctor don't have
you
much
will, you
knowledge,
shall, you must. No, please, Ultimate Health, this is how I do it. Because there's too much distortion out there. People are confused, right? Is the person I'm seeing supposed to be a doctor or a this and this and that? If we don't have enough doctors in a lower tier, let's just understand this. Who is supposed to be doing that interpretation and
so
stuff?
once you test positive,
yeah,
you have to see a doctor.
Okay.
Okay. You
I
have
like
to
that.
see a medical.
I like that. Now you're sounding like a doctor,
And then,
not like a politician.
Yes. Even the medical doctor who is seeing you may not have adequate knowledge when it comes to management of viral hepatitis B. So that person will later refer you to see gastroenterologist. Okay. So most of the time, it's the gastroenterologist that tends to manage and follow up these patient. Yes.
All right, folks. So you see why I invite doctors and not politicians. We can pin it down and it will not change, right? This is important because once you've been identified, now we want to do serious specialized stuff, investigating your status and so on and so forth. Okay, right. Somebody just sent this in. Can your liver function test be good, but you may still have hepatitis B virus? The question is specific to B.
Yes.
But I think we can broaden it and answer it. Yeah.
Yes, so you can have hepatitis B infection, but as you remember when Dr. Dia started, he mentioned that the liver cells are breaking down.
Right.
Okay, so you can have hepatitis B infection, but your liver function test will be normal because there isn't a lot of breakdown of your liver cells. Okay.
So it's hurt, but it's not seriously hurt.
Something like that.
Yeah.
Yes.
Yes.
But
So if I may come in,
All right.
all those who test positive to hepatitis B,
Right.
even if you don't put anybody on treatment, it's going to affect only about 40% of
Right.
those who have tested positive.
Okay.
So you can be positive for Hep B, but you will live your normal life without
Okay.
causing any damage to the liver.
Okay.
And that one would depend on, other factors,
All
the
right.
viral load, and then other things that you are involved in,
Okay.
or other risk factors that
Okay.
you tend to have.
Because your normal life
Yeah.
might not be normal. Oh.
Yes, so most people will come and they are positive for Hep B, and we will tell them that, okay, you don't require treatment at this time,
Okay,
and they
doc.
get confused.
Understood.
It's all because the virus is there, it's positive, but it's not causing any damage to the liver.
Okay.
And we need to follow you. up.
49 minutes
Yes.
past your hour. So the reason I'm doing this is because some people will now, after listening to us docs, they will start educating other people. Oh yeah, me how one more say, right? That's why I'm very, very picky on these things so that we hit it clear. All right. Management and other things, we'll get there. Can we just talk about C and distinguish it from B, right? So B is also quite prevalent
Yes.
in our part of the world.
Yes.
That's
so
where we got the
it's-
one in
it's
10.
endemic in Ghana.
All right. So it's
Yes.
all around us.
Yes.
Okay. So from what you're saying, there's a likelihood that Nortey may have been exposed. His body has dealt with it. Is he fine? Is his liver okay? Or have
Yes,
manufactured
once you have
settings?
been exposed, your body have dealt with it. You will even develop antibodies.
Okay.
That will prevent you from further
So-
or future infection.
But I'm okay.
Yes, you are okay.
But if I do the test again, will I be positive?
No, you will not be positive.
So when my body deals with it,
Yes.
there must be some seroconversion.
Yes.
My blood status for hepatitis must change.
Yes. So the surface antigen will be negative. You
Okay.
will rather have antibodies against the surface
All right.
antigen.
Okay.
Yeah.
We do serious business here, because if you listen to Ultimate Health, ultimately you get to know the difference between antigen and antibody. But if you don't, you are free to ask us. WhatsApp is 055 11 11 997. I have a caller? Nope. What's up? Okay. Yeah. Are there any warning signs? Is it hereditary? I just lost a schoolmate to a liver-related disease. This is from AC. My condolences. Anything you want to say to that?
So it's not hereditary,
All right.
and most of the time there are no warning signs.
Hey.
The best thing for you to do is just to know your status.
Okay.
Go to the
So anytime you hear there's
hospital
testing,
and check.
right?
Yes.
If it's endemic and it's around us, should this be a routine test that I do periodically?
So ideally, anybody living in this country
Joy
should have
99.7
done the
FM.
test before.
Okay.
Everybody should do the test before.
Okay.
Once we find ourselves in an endemic country, it means that even if you do the test now and it's negative, you are at higher risk of getting the infection.
Okay.
So once you are negative, then you need, as the good news about hepatitis B is that there is vaccine available
Right.
that you can get and protect you from future infection.
Even if you've been exposed.
If you have been exposed before, then the vaccine will not work.
Aha.
Yes.
Okay.
But once you are negative, you have not been exposed before, the vaccine is there and you can get protection from those vaccinations.
Right. If you've been exposed, you are not a candidate for vaccination. Right?
Yes. Yes.
Yep. Okay. I like that clarity. Okay. C. Hep C.
So C, the transmission is also like hepatitis B.
Okay.
But that one is mainly through blood.
Okay.
It's mainly through
Mainly.
blood. Yes. So those who normally get C are those who indulge in injection drug abuse.
Okay.
Those find themselves in ghetto,
IDUs.
and they are just
But Doc,
circulating the.
ID users, they're not just ghetto these days. It's not just the ghetto. But you do go ahead.
Sure. So I mean, it's those are the ones that mainly get the hepatitis C.
Okay.
Okay. And it's also because of bloodborne. If you use
Personal care items.
Personal care, tattoos,
so sharp
tattooing,
objects.
all
That's-
this body art
Razors.
that is
yes,
going on.
Yeah. And
Piercing
Sure.
and all the stuff.
Sure.
Huh?
Sure. And if you look at C2, the prevalence in the 5 northern region is
Right.
higher than the rest of the country.
Okay.
You can get up to about 14%, whilst the whole country is around 2.5 to 3%. Okay. And because of the route of transmission,
All right.
we have identified that because they do a lot of scarification marks, the tribal marks,
and all that.
and then the circumcision that
Right.
are done at the level of the community. I mean, if those instruments are not sterilized well, then that one become the source of transmission.
Okay.
So C is mainly through blood.
Okay.
Yes.
Right. Does it present differently? Are there different issues? And does it follow the line? With B, we know there's a vaccine. What's the outlook or
The
profile?
presentation tends to be the same.
Okay.
Okay, in terms of presentation. But Hep C do not have vaccine.
Okay.
So we don't have vaccine that protect you from Hep C.
Right.
Okay. Maybe when we get to the treatment, you will get to know that we have a cure for hepatitis C,
All right.
whilst hepatitis B we treat.
Okay.
Yeah.
Treatment versus cure. I like this discussion. Africans don't like management, treatment. They like cure. All right. So let's hit that one. There's treatment for hepatitis C.
And there's a cure.
And
for
there's a
hepatitis
cure
C.
Yes.
for C.
Yes.
What does cure mean in this context?
So in this context, cure means that we can get rid of the virus from your body
Okay.
if you have C
Okay.
by using medication.
Right.
Okay. But for hepatitis B, we
Joy,
use treatment
99.7
to
FM.
suppress the amount of virus that is inside the body.
Hmm.
But because the virus, if I use the word integrates or brings itself into the liver cells,
Right.
it's very difficult to remove the hepatitis B virus from our liver cells.
Okay.
So for hepatitis B, we treat with
Okay.
medicine. But for hepatitis C, because the virus does not quite do the same thing, we can give medicine that will clear it or remove it from the body.
Okay.
That's why we say we can cure hepatitis C.
All right.
And we use 3 months of medication
Okay.
for hepatitis C to cure it.
All right.
Whereas for hepatitis B, we give long-term, most of the time, lifelong treatment.
Okay.
The same way a hypertensive would take their medicine long-term.
Okay.
That's often the same way if you have hepatitis B, we would give you your treatment long-term.
Okay. So whilst I'm on treatment, right, with C, the ultimate destination is full cure.
Yeah.
Does that mean I can't get it again?
You can get it again if you are exposed or you have the same risk factors being present. So for hepatitis C, just because you get it and you get the treatment, it doesn't mean you can't get it again.
Okay.
So if you are still doing your injecting drug use or,
Whatever
practicing-
exposed you in the first
exactly,
place.
you could, in theory, get hepatitis C again.
Okay. Right. So again, I understand there's a campaign of free treatment for Hep C.
That's right.
Right.
Yeah.
What are the details of that?
So currently in all regional and teaching hospitals, there's medication for treatment for hepatitis C.
Okay.
And this came about through a donation from the Egyptian government to the government of Ghana. And the Ghana Health Service and the Ministry of Health
Okay.
are the recipients and are implementing this free treatment.
Okay.
So at all the regional and teaching hospitals, there are people who have been trained to be able to know that when somebody comes and they have hepatitis C, these are the extra tests we need to do. If the extra test is positive, it means this person needs to be put on treatment for 3 months.
Okay.
And it's also supervised by senior consultants like Dr. Amwakudia across the country. Yes, please.
Okay. So the earlier upstream investigations, the actual tests, the determination of whether it is C or whatever, that is not free.
No, the testing is not free.
Okay.
But the treatment is
Treatment is free.
Yes. Normally, I mean, before this project came about, if somebody was hepatitis C positive and they went ahead and they did their viral load and it was also positive, then they would pay anywhere from 5,000-6,000 Ghana cedis, even up to 12,000 Ghana cedis for a 3-month course of treatment.
Okay.
But now, because of this free treatment project, they don't have to pay for the treatment.
Okay.
Though they still have to pay for the testing.
All right, Doc. So, Doc Amakudria, how serious a problem is Hep C? I know, okay, we're not beyond the aid yet, and we've gotten some aid, so free treatment. But how many people is it going to cover in terms of how widespread is C?
So yes, C is widespread, as we said, mainly in the northern part of this country. Okay, and as you said, the Egyptian government is willing to provide us medication to cover everybody that will test positive.
Right.
Okay, so as you said, it's a serious business because Hep C, hepatitis B, can cause liver failure, what you call liver cirrhosis, and cancer of the liver. And as you know, liver cancer is the commonest cause of cancer death in this country. It kills more than any other cancer in this country. And then it's also a severe form of cancer. So most of the time when we diagnose patients with liver cancer, within 2.5 months, they are dead. Okay, whoa. Yes. And then it's also the major cause of liver cirrhosis, which is liver failure, which is also the leading cause of liver disease. And it's also the leading cause of mortality in terms of liver disease.
Couldn't we find anything else to lead in? We are leading in all these things and the leading cause. And it's serious business. And we haven't even touched that yet. We haven't gone to those advanced complications.
Yes.
So if you are determined to have hepatitis C, there's treatment available and it results in cure.
Yes.
Right?
Yes.
So there's cure available for you.
For Hep C, yes.
So nobody should be suffering this and walking around thinking it's a dead end. There's a program, right? You said all regional hospitals and what?
All teaching hospitals.
All teaching hospitals.
That's right.
So it's not being, should I say, administered at the lower tier, like a polyclinic and so on and so forth. No.
So currently in the in Upper East, there's also one district hospital that is also offering the treatment, and that's because of the studies that we've done that's shown that the burden is very high there. So additionally, there's a district hospital implementing as well.
All right, we've done some good work. We didn't get any traction on the phones, but on WhatsApp we got that. Is it possible you're based in Cape Coast? Oh.
Now I'm in Accra.
You're in Accra?
Yes.
Okay. So I bought you for life.
For the next few years.
For the next few years. Okay. But what I'm essentially trying to look at is whether next week we can have the two of you and then go into the post-diagnosis phase. Okay. Who is on monitoring and observation? Who is supposed to be taking vaccine or not, whatever, how many shots are there, over what period, and how, more importantly, does your status change? Okay, if I'm on treatment or management for Hep B, at a point I asked Doc, I will test negative. Is it a matter of viral load? Is it that it is below a certain threshold and so on and so forth? And what, importantly, does that mean for me, close family, my medical status, friends, sexual partner or partners? Right? We didn't talk too much sex and unprotected sex, right? But we need to get into that so that people understand. There's a high rate of default from the little I know from where I sit, not just behind this microphone. People start a program, they even start the vaccine shots and things, and then we lose them. Okay, they think, I've been fine, what's the big deal? It can buy tilapia and other things, you know. So then we lose them. So we need to do that education where we know what's available, and especially because the, should I say, related tests and further investigations are not covered by some of the campaigns what we do periodically, right?
Yeah.
So if you are asked to do further tests, then people start getting a bit concerned and anxious that what's the big deal, okay? But there are a whole range of further advanced tests that need to do to should I say, isolate important markers,
Yeah.
right? That would relate to your health. So once again, thank you, Dr. Amakudua from the University of Ghana Medical Center, consultant gastroenterologist, and Dr. Yvonne Anyeki Nortey, formerly of Cape Coast, Accra.
Temporarily.
She has crossed carpet,
Just temporarily.
and I am the speaker. No Supreme Court. Shall take her away, but we are most grateful, and we're hoping next week we can do that more detailed should I say discussion. But what you're saying is anybody who's identified as we speak, there's free treatment and cure for C.
Yes.
Okay. All right, folks, I've already stolen 3 minutes of extra time because my
Joy,
producer is enjoying the show.
99.7
He's having fun. I think he's outside with Dr. Anyaki's. She came with her husband, in case you're getting ideas by watching us on Facebook, and she's protected, rightly so. So he's also a doctor, he's here. Stick and stay on Joy 99.7 FM. Ziggy is coming up with some good music, which is also likely to go viral. Stick and stay, don't go away.
Joy 99.7 FM.
Oh life. I'm afraid of the dark, especially when I'm in a park and